Welcome to the Patient Care Coordination 2018 Domain Update webinar. Thank you for joining us today, and I am Amit Popat. I will be one of the two planning co-chairs in the Patient Care Coordination domain. All right, so the purpose of today is really to give a brief history of IHE and the PCC domain. If you are interested in more information on IHE, there's a lot more information on the IHE.net website, and there are also other webinars that have been recorded that are available on the website. A little bit of explaining of the vision, the mission, and strategic goals of this particular domain, PCC, or Patient Care Coordination, and its relevance within IHE, and also describing the work we've accomplished in this cycle, and I'll go over a little bit of what the work cycles are, and finally identifying opportunities for your organization or organizations you might be aware of to participate in the PCC domain activities, and also on how you would get engaged. All right. So I'm going to dive right into it. A little bit about IHE. IHE has started off with the radiology domain in 1998, and since then has expanded to several more domains. And we are the Patient Care Coordination on the bottom right, established in 2004. If you're interested in learning about the different domains, they all serve within healthcare. ITI is kind of in the middle with the infrastructure for IT. If you're interested, you can go to the IHE.net website, as I said, and check out any of the webinars or the information available there for more in-depth information. A little bit about PCC. As I said, formed in 2004. We are sponsored by two organizations, the American College of Physicians and HIMSS. The first PCC Profiles focused very heavily on content for exchange of data. Some medical content or medical summary was the first one, XDSMS. It was delivered in 2005 for trial implementation. Since then, PCC has expanded quite a lot. We now have about 23 content profiles in various phases of the process, and 9 workflow profiles and 7 integration profiles, including 4 FHIR-based profiles. Okay. Our vision is to continually improve patient outcomes through the use of technology, specifically when exchanging data that is clinical data between systems and between disciplines and care paths. We accomplish this vision with the help of our mission and a lot of wonderful volunteers that participate by developing interoperability profiles and content profiles to support the coordination of care for patients, where the care crosses different providers, different specialties, different patient conditions, or health concerns, or even time in general. Now, the PCC technical framework is used in national programs in the US, France, Italy, EU, and several places in Asia. Here's a general scope that PCC limits itself to or dabbles into. Anything that has to do with document exchange related to clinical care, order processing, with the clinician perspective, a patient perspective, Often we're coordinating with other IHE domains where we're exchanging data, for example, with cardiology or public health and so on. And the workflow and integration needs tend to be common to multiple specialty areas. So we also don't limit ourselves to just document exchange. There's clinical message exchange, clinical reconciliation, workflow management, including a few now integration profiles that are FHIR-based. Here are some of our strategic goals. We want to coordinate with external standard development organizations to develop and promote the use of content templates, develop strategies to support multi-level content template guidance to benefit the global community. And from a workflow perspective, we've developed and want to continue to develop profiles by reaching outward to other IHE domains, and white papers by researching new areas that could benefit interoperability guidance. The third area is nursing that we focus on, exploring and understanding the benefit of IHE profile work within the nursing community by partnering with nursing organizations and initiatives. A lot of documentation and care is done by nursing staff, and exchanging and making sure that that transition benefits their day-to-day lives is part of our strategic goals. As I mentioned, there are quite a few places that the PCC has a presence in France. There are some links there. There's a lot of implementation there, and also people doing development based on the profiles. There's work going on in Italy, particularly around the workflow definition, workflow coordination profiles, a bunch of work in the US and Canada, data access framework, SNI framework, etc. In Asia and China, there's an implementation. There's a link there that you can read up. And there's also medication, immunization, and referral work happening in Saudi Arabia.